Sex addiction. What it is, why it happens, and how to heal. Sex addiction is a term that describes a condition where a person has an intense and uncontrollable preoccupation with sexual thoughts, fantasies, or behaviors that interfere with their daily life, relationships, and well-being. Sex addiction is not officially recognized as a mental disorder by the American Psychiatric Association, but it is considered a form of compulsive sexual behavior that can develop, like a chemical addiction. Sex addiction does not have to do with how high a person's sexual drive is, how much sex they have or want, or how much porn they watch. It has to do with the way someone relates to these things, why they engage in them, and how it then impacts their lives. Sex addicts may use these behaviors to numb and to escape instead of to heighten and enjoy. Some signs of sex addiction include having sex with multiple partners, having intense sexual fantasies, using sex to escape from problems or bad feelings, engaging in dangerous or risky sexual behavior, feeling shame or depression after sex, spending excessive time on sex, excluding other activities, having trouble making and keeping healthy and stable relationships. Sex addiction can have serious personal consequences such as the possibility of getting or giving someone else a sexually transmitted infection, the loss of important relationships, trouble at work, financial issues, or legal problems, damage to self-esteem, self-worth, and self-respect, physical and mental health problems such as depression, anxiety, stress, or suicide ideation. Sex addiction can be caused by various factors such as biological factors such as genetics, hormones, or brain chemistry, psychological factors such as trauma, abuse, neglect, attachment issues, or personality disorders, social factors such as peer pressure, cultural norms, or media influences, environmental factors such as stress, boredom, loneliness, or availability of sexual stimuli. One of the most common causes of sex addiction is trauma, such as being sexually assaulted, abused, or exploited. Trauma can affect the way a person perceives and responds to sex, either by causing a total disinterest in sex or a hypersexual behavior. Trauma can also impair a person's ability to trust, bond, and communicate with others, leading to dysfunctional relationships and isolation. Another common cause of sex addiction is porn addiction, which is a subset of sex addiction that involves excessive and compulsive use of pornography. Pornography addiction can alter the brain's reward system, making it harder to feel pleasure from normal sexual stimuli. Pornography addiction can also create unrealistic expectations, fantasies, and fetishes, making it difficult to be satisfied with real-life partners. Sex addiction can be treated and healed with the help of professional and self-help resources. Some of the treatment options include cognitive behavioral therapy, CBT, which helps identify and change the thoughts, feelings, and behaviors that fuel sex addiction. Dialectical behavior therapy, DBT, which helps develop skills to cope with emotions, stress, and relationships. Psychotherapy, which helps explore the underlying causes and effects of sex addiction. Group therapy, which helps share experiences, support, and feedback with others who struggle with sex addiction. Medication, which helps manage the symptoms of depression, anxiety, or other co-occurring disorders. 12-step programs such as Sex Addicts Anonymous SAA, which help follow a spiritual and moral framework to recover from sex addiction. Self-help books, podcasts, websites, or apps, which provide information, guidance, and motivation to overcome sex addiction. The most important step to heal from sex addiction is to admit that there is a problem and seek help. Sex addiction can be a lonely and shameful condition, but it is not a hopeless one. With the right treatment and support, sex addicts can regain control over their sexual behavior, restore their self-esteem, and rebuild their relationships. By Lena Kravitz.